Hello, and thank you so much for joining me for today's interview with Dr. Alissa Rexo. Hey, Alissa, how are you doing?
I'm doing well. Thanks for having me.
Oh, it's so great to have you. Would you mind introducing yourself a little bit so we know who you are?
Absolutely. So, I'm a veterinarian that's specializing in dermatology, and I reside in Virginia. And I've been practicing for close to 15 years.
Oh, wow, that's quite a long time. Why did you choose to become a veterinarian?
I grew up in New Hampshire on a small hobby farm, and I was pretty surrounded by animals through most of my childhood. I participated in the local 4 H club, and becoming a veterinarian was just the lifelong dream.
And why did you choose to specialize in dermatology specifically?
So during the time I was in general practice, I had the opportunity to treat a variety of animals, including horses, goats, miniature pigs, dogs, cats, rabbits. And what I was finding is about 70% of the patients I was seeing were being treated for illnesses related to ears, skin, or allergies. And a fairly large percent of those cases, I was referring to the dermatologist for further diagnostic testing. So during that time, I really developed an interest in following those cases further. And a big part of that was dermatology.
Oh, and so, yeah, that makes sense that you then chose to go into dermatology more specifically. But what fascinates you most about your work?
So immunology is a really central part of what we do in dermatology. And it's a really fascinating and it's evolving continuously. And there's been so much that we've learned over the past decade as biotech has continued to advance. So we have a lot of different opportunities and treatments in dermatology through the immunology advancements.
Hmm. And how many patients do you treat in a normal day?
On average, I usually treat about 10 to 15 patients. It makes a difference if we're seeing new patients versus recheck exams. The new patients take a lot more time because they often have a lot more of a complex history that we have to read through and discuss with the owner.
Hmm. Do you have any patients that were particularly interesting or that just somehow stick with you over time that you remember now that were somehow interesting or fascinating or just something unusual?
Yeah, that's a challenging question because there's probably not just one patient. I think the probably most rewarding ones are the ones that come in with the most complicated medical histories. I know I had this Chihuahua patient a couple years ago that had a history of a lung tumor resection, and he was being managed with a cardiologist for primary hypertension. And during that time, he developed an autoimmune condition called pemphigus foliaceus, and he required numerous immunosuppressive treatments. And he had developed such severe crusting on his paws that he was having difficulty walking. So we were able to control his oral and his topical medications, and we really gave him a good quality of life during the last year he had with his family.
Hmm. And one of the real broadly questions, and then we can start with introduction about yourself. But in the context of animal health, is there anything that you worry about right now?
Yeah, it's a good question. I think right now we're seeing so much multi-drug resistance developing in our patients, and these superbugs have started to emerge. And it's become a big problem over the past decade. And it's putting not only our clients at risk if they're immune compromised, but it also makes our job extremely challenging as veterinary dermatologists.
Hmm. Yeah, since you mentioned all these superbugs and bacteria, do you have a favorite microbiome or favorite microbe? Since this is a my dog interview and we only focus on bacteria and fungi, do you have a favorite one?
Yeah, I think if I had to pick one, Pseudomonas aeruginosa would probably be my favorite microbe. And I say that because it's also my nemesis when I see it with my patients. Um, it's a gram-negative bacillus bacterial organism, and it's just a really common cause of chronic otitis and ear infections in dogs. Occasionally we do see it in cats, but it's a really challenging bacteria to treat because it forms a biofilm, and that's what leads to these chronic middle ear infections in patients. Biofilm is the slimy buildup of bacteria, and it protects these microbes from antibiotics and ear cleaners that we prescribe. So it's really important that we're able to identify a bacteria like Pseudomonas so that we can prescribe the appropriate treatment.
Mm-hmm. Yeah, the microbiome becomes more and more increasing awareness, so clients might start asking about it, and it's really a fascinating word that we've been working on, just investigating all these different microbes that infect animal health. When a new patient comes in, how do you typically proceed to even understand what is going on?
Yeah, on initial presentation with a patient, we really take a thorough history. We ask owners about the diet they're feeding and supplements and preventatives that a pet receives every day. And we also want to know if an animal is itchy. We ask an owner to rate an itch level 1 through 10, so we have an idea of the severity. And we want to know if it's a seasonal or a continuous problem, as well as if other humans or humans in the household are affected, or if there's any skin lesions that are present on humans or pets in the household. Then we kind of move on to taking or performing a really comprehensive dermatologic exam, and we take photographs to document the lesions. So we have comparison photos we can go back to as we perform rechecks on the patients.
Mm-hmm. And for the dermatologic exam, what kind of diagnostic tools do you use? For example, culture we know is already 150, 180 years old by now. Do you think there's any room for improvement? I know it's still considered the gold standard in veterinary medicine. So I assume you use it as well in comparison with cytology, maybe?
Yeah, well, when we first see a patient, we definitely still perform skin cytology just for an initial assessment, to take a look at infection beneath the microscope and determine if it's bacterial or fungal in origin. And we also perform a test called a skin scrape or a trichogram. And that involves just gently squeezing the skin or plucking several hairs from a patient to examine under the microscope for skin mites or um, possible fungal organisms or something that we would call dermatophytes. We look at the pattern of the hair breakage, and that gives us an indication if it's a self-inflicted trauma that the pet has caused to themselves, or if there's an active infection of the hair follicles. And then we still do perform some skin culture testing, but again, the value can be somewhat limited. The fungal cultures, we even run in-house sometimes in a test called a DTM culture. The problem that we have with culture is that not all organisms will grow, and it can be difficult for certain bacteria and fungal organisms to get them to grow appropriately. It can require special conditions and extended periods of time. So the results are not always accurate. And it also doesn't give us a comprehensive picture of the overall microbiota, because there can be variability in the culturing of different bacteria. And it can take up to several weeks for some of these fungal organisms to grow appropriately, and sometimes they just don't grow at all.
Mm-hmm. Yeah, and one way to investigate all those microbes is by investigating the microbiome using DNA evidence, and that's actually how we met too. And so, what inspired you to do the microbiome research on dog skin?
Yeah, I've had a really strong interest in holistic medicine for over a decade. I'm actually a certified veterinary acupuncturist, and I did a year-long training program for my certification that I completed in 2008. So I started treating a lot of my patients after that time with probiotics and I even utilized fecal transplantation. And what I was seeing was a really positive energy response in improved digestion in the dogs that I was treating with these therapies. I had a personal dog, a Great Dane, um, who had several orthopedic and cancer issues. And she really taught me a lot about integrative medicine as well as providing senior care to a pet. So I was fortunate that she lived for 10 and a half years. That was significantly longer than what her prognosis was based on her medical conditions. And she was just a really special heart dog to me that taught me a lot about incorporating integrative medicine into the treatment for my patients.
Yeah, it's so wonderful to have a pet like that. Um, what did you learn from the microbiome? Did this change at all how you approach new cases now that you have conducted your own study and you've learned so much more about it?
Yeah, the study that I conducted looked at the skin microbiome in French bulldogs specifically, but what it showed us was that topical therapy in dogs may improve microbial diversity. And this was a really exciting finding. Um, I'm definitely finding myself prescribing more topical therapy in my patients to treat infection, but also to maintain a healthy skin barrier.
hmm So yeah, that's great findings. And that way you can reduce the use of maybe unneeded antibiotics. So that will help antibiotic stewardship. Yeah, in general, the numbers of bacteria that are present on our dog skin are really high, just like our own, right? We are all covered in bacteria and fungi. And which ones of these bacteria do you pay any special attention to when you evaluate your patients?
Yeah, the main bacteria that may be pathogenic on the skin of dogs is Staphylococcus pseudointermedius. We tend to see some normal resident bacteria in canine skin as well, including coagulus negative staphylococci, streptococci, micrococcus, and acinetobacter. But dogs can develop a multi-drug resistance and specifically a methicillin-resistant staphylococcus infection. And these infections are similar to MRSA that's discussed in human medicine, but they're not identical. Dogs frequently develop subspecies known as MRS-P or MRS-SS. And unfortunately, what we've seen is that human healthcare workers can actually transmit multi-drug resistant staph infections to their pets. So it's really important that we're able to identify these antibiotic resistant organisms early so that we can eliminate them from a household.
Oh yeah, that'd be awful to transfer them to your pet or maybe the other way around.
Mhm.
So, but these things we learn from studying the microbiome, right? Can you tell us more specifically how an improved knowledge of the canine microbiome could treat these conditions and diseases?
Yeah, I think that if we're able to identify what the normal composition of a canine skin microbiome should be in a dog, then we can really better identify what's abnormal with a patient with disease or what we call dysbiosis. And I think it's really valuable for us to understand the distribution of what normal microbiota should be at different specific body site locations, because then we're able to implement the appropriate topical therapies so that we can support a healthy microbiome in these patients.
Mhm. And yeah, we're learning more and more what a healthy microbiome looks like. And so, in your opinion, you think canine medicine could benefit from microbiome research?
Yeah, I think what we're seeing is in a lot of the studies that are being done is that there's a big difference between the bacterial diversity in the skin of healthy versus allergic dogs. And we've seen that there's a close connection between the canine gut as well as the skin microbiome. We've seen that the microbiome actually influences a dog's metabolism as well as their immunologic activity. And if they have a imbalance, they can actually develop gastrointestinal disease or other infections. So I think it's really important that we're able to support a dysbiosis through appropriate probiotics or diet changes, as well as topical therapy.
Hmm. Yeah, when most people think about the microbiome, bacteria come to mind first. And most studies are actually exclusively looking at bacteria, but sometimes we tend to forget that fungi are all around us at all times as well. And they are maybe not in high numbers as bacteria, but they're so much larger. The cells can be 1,000 times larger than an E. coli, for example. So we don't actually know very much about all the fungi that surround us and our animals. And we're just beginning to learn more about them because we're now studying their DNA evidence rather than trying to grow them in the lab. Since you mentioned earlier too, it sometimes can take up to weeks to grow them. So that's why we just don't know as much about them, because sometimes we simply don't have to have the time to wait around and wait several weeks to see if maybe something grows or not. But now that we know more about the role of fungi in canine health and in the dermatological health aspects, what can you tell us about those fungi? Have they been on your radar for a long time, or do you pay more attention now?
Yeah, I think we've recognized that there's some fungal diversity, not only on the skin, but also in the gut and in the mouth and on mucosal surfaces. There's definitely been studies looking at the bacterial microbiota, but I think that there's some recent studies that are looking at the fungal microbiota in an altered kind of disease state in patients. What we see in our patients as a dominant fungal skin organism is Malassezia. And it can really overgrow on the skin of dogs, particularly in the allergic patients that have a compromised skin barrier and an altered skin pH. And what we've seen is that if we can properly control Malassezia with topical therapy, and we can stabilize a skin barrier as well as control the skin pH, we can improve the overall health of the skin and improve the symptoms that are present in our allergic patients. So it definitely makes a difference if we can control those fungal organisms.
Hmm. And when you can control the skin health, does that reflect on the overall health of the pet? I would assume so.
I think it improves their quality of life. And what we see with our pets and our allergic patients that we treat is they become stressed and they itch, and then the itch leads to anxiety and more stress. And it's just this continuous circle of itch, internal cortisol level release, anxiety in some of our patients. And I think if we can control the infection that results as a secondary consequence from them itching, I think we can give them a better quality of life.